Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Welcome to The Dose. My name is Dr. Joelle Brevel, and since our last season, I've started my medical residency. Every day in the hospital reminds me not only why I went into medicine, but also how much our healthcare system still needs to grow. This season's conversations come at a pivotal time when trust in science is under attack. From leaders spreading misinformation about medications and vaccines, to disinformation flooding our social media feeds, the need for truth has never been more urgent. That's why The Dose exists. Fresh ideas, new perspectives, and compelling conversations about where healthcare is headed. This season, you'll hear from Dr. Francis Collins, longtime NIH director, Dr. Fatima Cody-Stanford on obesity medicine, Dr. Kevin Simon on mental health, Dr. Mai Pham on healthcare payment systems and intellectual developmental disabilities, Omari Jimerson on community health, and cultural leader Elaine Walteroth on maternal health. Change begins when truth is spoken aloud, and together we can reimagine the future of healthcare. Join me for new episodes starting on October 10th. This is The Dose.
Find The Dose from the Commonwealth Fund at thedose.show or wherever you get your podcasts.
Hey listeners, it's Lindsay Smith-Rogers, producer of Public Health on Call. Today, we all know what a pharmacist does, or do we? Dr. Christina Madison is known on social media as the Public Health Pharmacist. She talks to Dr. Josh Sharfstein about what this means, the role of pharmacies in supporting the health of the population, and what her vision is for pharmacies in the future. Let's listen.
Dr. Christina Madison, thank you so much for joining me on Public Health on Call. You are known as the Public Health Pharmacist, is that right?
Yes, correct.
As soon as we saw that there's a public health pharmacist, we wanted to dial you up. How are you doing today?
Fabulous. Living the dream, doing my best.
So tell us all a little bit about yourself and your professional journey.
So I have been a clinical pharmacist for almost 22 years. And a majority of that time I have spent working in public health and advocating for marginalized and historically underrepresented communities. And I work specifically in the communicable disease space, so infectious disease. So I am credentialed with the Academy of HIV Medicine, and I'm also a vaccine advocate, have probably administered thousands and thousands of vaccines in my career, and really advocating for sexual health and reproductive health and justice. And it's been an amazing adventure, and I'm so grateful to be able to do this work because I get up every day and I know I'm able to help people.
Well, I really appreciate that. And I think it's worth talking for a second about the role of pharmacists, because many of us just interact with pharmacists maybe when we're getting a medication filled. But you have spoken about, and there's a lot of research on pharmacists playing a really big role in public health. HIV might be a good example to start. In many states now, pharmacists can prescribe medicines, prep medicines to prevent HIV infection, and even post-exposure medicines that keep people after they've been exposed from getting HIV. Is that an example of an extra role that pharmacists can do for public health?
I would say that's definitely one, as well as being able to offer contraceptive services as well, which is a huge public health imperative to be able to provide folks with the ability to plan their families and to not have an unintended pregnancy. In addition to sexual health and wellness, which you mentioned through HIV prevention, whether that's through post-exposure prophylaxis or pre-exposure prophylaxis.
So in some states, pharmacists can prescribe oral contraceptives, for example.
So it's not just oral contraceptives, it's the pill, the patch, the ring, as well as the injection. So it's everything that can be administered that doesn't have to be inserted by a healthcare provider. So the long-acting reversible forms of contraception like IUDs or implants cannot be done at the pharmacy, but everything else can.
And what is the advantage to having access to these kinds of products that we're talking about through the pharmacy as opposed to, well, just go to your doctor or nurse practitioner to get them?
So one thing I want to make sure is clear is that we're definitely not trying to take work away from any of our other healthcare professional colleagues. I am very much a supporter of my nurse practitioner, physician, and PA colleagues out there. What we do want is to be able to really help optimize the services that are already happening. And if you think about some of the statistics related to pharmacy and pharmacy practice, we know that the average person that has a chronic medical condition has 20 touch points a year at a pharmacy versus with your physician, you may see them once, twice a year. If you have, a chronic medical condition that requires a little bit more monitoring, you potentially may see them more frequently, but you see your pharmacist much more frequently.
So advantage one is you're already there.
Correct.
You're already talking to your pharmacist. What would be advantage two? Maybe the convenience?
Oh, for sure. I would say convenience, and then also just the ability to get access to services in a more rapid succession because you may have to wait. Most women have to wait up to 30 days before they can get an appointment with their OBGYN versus going and making an appointment at your pharmacy. You can do that within maybe 24 to 48 hours.
Right. And for some of the services we're talking about, like post-exposure prophylaxis for HIV, it's got to be within a certain time window or it doesn't work. So
72 hours.
Right. So that time sensitivity becomes really important and really makes you start to think about the role of pharmacies differently.
Absolutely. And I would say, the average American lives within 5 miles of a pharmacy. And so again, it's that accessibility as well as just the community nature of you having a rapport and trust and a relationship with your pharmacist that really helps to be able to provide some of these public health services, especially when, folks may not feel comfortable speaking to their healthcare professional about some of their, sexual health needs or family planning needs. They may feel more comfortable talking to their pharmacist versus their provider because they may think that they may be shamed or blamed because they want to get on PrEP, or maybe that they've had an encounter with an unknown status person and they don't want to talk with their provider about that.
What about pharmacists would make someone be more likely to talk to a pharmacist?
I think it's just first and foremost, I would say, number one, it's the friendliness, the accessibility, the fact that they already know the medications that they're taking. So there really are no secrets at that point. I know everything that you're taking, so there's no secrets there. And then also just the fact that we have the ability to spend more time with the person. Average doctor's visit is between 10 to 15 minutes, and they really don't have the time to go through the extensive counseling and, really be able to answer a lot of the questions that folks may have about medications, where they can go to access services. And the pharmacist really allows for that to happen. And again, we're all practicing some form of public health by providing these types of services.
Sure. There are certainly a lot of busy pharmacists out there too.
I would agree. So I do think that this is a good time to say that not all pharmacies are the same. So there are large chain pharmacies. Those large chain pharmacies oftentimes do not have the bandwidth to do some of these services. And then after the large chain pharmacies, we have our grocery pharmacies and our, Walmarts, our Kroger's, those kinds of things. They tend to have a little bit more time. And then you have your regional pharmacies, which typically there's, maybe 12 to 15 within a certain region or within a certain state. They tend to have a little bit more time to offer these services. And then ultimately your independent pharmacists and your independent pharmacies, they're really going to have the time to go through and do a lot more of these services. I have a colleague of mine, her and her husband own a couple of pharmacies in Virginia, and they are actively going out in the community to vaccinate, and they have a partnership with their Virginia Health Department. And it was such an amazing partnership that I thought about. I said, wow, what an amazing opportunity for pharmacists to partner with public health, because their hours are different than public health. And so why not augment with pharmacy that's open more accessible hours to be able to get these services to folks who need it?
So COVID-19 really provided a major opportunity for pharmacists to demonstrate their value to public health. Huge numbers of people got vaccinated in pharmacies. And really, to this day, I think people think about getting routine vaccinations, particularly the annual flu vaccine, boosters, or the updates, I should say, to the COVID vaccine at a pharmacy. That's a bit of a shift for Americans' perception of where to get care.
I would say that we started seeing that shift during H1N1. I was during that time as well. I was working at our county health department, and I was an incident commander during that time. So that was when we first started to demonstrate that we could really be able to do the heavy lift during a public health emergency. And then after that, I think that really prepared us to be able to be that primary source for vaccinations during the COVID-19 pandemic when the vaccines came out through the federal pharmacy program.
And as we're talking, there's definitely a lot of uncertainty about whether people will continue to be able to get COVID vaccines through pharmacies. How do you see that?
So it really is state by state, unfortunately. So at the federal level, we know that we had a delay in the FDA approval of the new booster dose for COVID-19, which really caused some confusion within the pharmacy world. And then also when the approval came out that was only for those 65 and up and those with high-risk conditions, it definitely was counter to what we previously had, which was universal recommendations for everyone 6 months and up. And so that did really take us for a loop. And so what I think you're seeing now is that state by state, they are deciding, do they want to go back to the previous FDA approval and have a statewide that is assigned by the state health official that says that we can vaccinate anyone and that pharmacists can provide those vaccinations, or do they want to stick with the current FDA approval, which means that it causes more barriers to care for the average American that really just wants to protect themselves and their family?
Yeah, I'm impressed that there's been a lot of pushback on the idea of having that access impeded.
I agree. I think people really want things when they're told they can't have them. Because if you think about how many people got the COVID booster last year, it was like I couldn't give it away. Like I was having, I'm like, do I need to pay you something? Because I do community outreach, and I was having a darn time getting people to accept the COVID-19 vaccine. And now you see a lot of people asking about where can they get it? Can they get it for their kids? We see, ACOG coming out and saying, nope, we disagree with the federal recommendations and that we are, sticking with our current recommendations that pregnant women and children, even healthy children, should be receiving this vaccine because of the reduction in harm.
Let's talk about the future for the public health pharmacists. What do you think are opportunities that really haven't been fully tapped for pharmacies to be even more engaged in public health?
So if I could rule the world, my number one thing would be to have a pharmacist, a dedicated pharmacist in every health department in the country. And then the next thing that I would say is that I would highly recommend for community pharmacies to partner with their local health officials because of the fact that we know that federal funding is being limited at these public health departments. And so this is a way for us to expand those public health services without necessarily having to specifically expand the public health workforce. I would recommend working with schools of public health because those, brand new MPH students, they need a place to train and they need a place to see where public health is in action. What a better place to see that than in pharmacies? And to engage with community health workers, because I think that really is the next future, is that we have community health workers embedded in our pharmacies. We're doing that now with training our pharmacy technicians to be community health workers so that we can really facilitate the needs of the public as it relates to our public health needs, specifically vaccinations, chronic disease management, chronic disease and health promotion, as well as, things like test to treat. It's much easier for me to just go and get a COVID test and be able to get Paxlovid at my pharmacy than it is for me to try to get an appointment with my primary care provider.
I think you're making the case that there's an incredible resource for public health that's kind of been hiding in plain sight. Well, Dr. Christina Madison, thank you so much for all you're doing to get the word out about public health and for your leadership in the idea that pharmacists can really play a major role in helping their communities become healthier.
Thank you so much for having me today.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.